just remember then 3 neurologists sat my brother and my wife down, and I just knew there was something wrong. And then they sort of told us that you've got MS. And it's just alarm bells in the head going, and you're just thinking to yourself, there's no cure for this. You're just going to be left in a wheelchair.
I remember screaming so loud outside the front of Box Hill Hospital.
Since then, Nick's been plagued by fatigue, migraines, blurred vision, pain and numbness in his legs, and dread about what still lies in store.
So you got to check for the whole coronavirus thing.
In a week's time, he's supposed to fly to Moscow for a stem cell transplant, a treatment that halts the progression of MS in about 80 to 90% of cases like Nick's.
It's going to be effective, you dream.
Think so, I δούμε άμα αλλάξουν τίποτα, but I'm due to leave on Friday.
It involves chemotherapy, which will suppress his immune system.
Πιστεύω να είναι εντάξει, αλλά θα δούμε.
I was still adamant that as long as I'm permitted to travel, I'm heading over and I'm doing this treatment.
You did that with brilliant stuff today, mate. I'm looking forward to coaching you next week, okay?
MS is an autoimmune disease, which means Nick's immune system doesn't just defend him from infections, it attacks healthy cells. No one knows why it happens, but MS damages the protective coating on nerves in your brain and spine, causing lesions. Nick has more than 50. These distort messages from the brain to the rest of the body, sometimes leading to severe disability. There's no known cure.
Alright guys, Bridgie. Wait, let me get your piece as well.
Stem cell transplants, known as HSCT, have been very successful in clinical trials, especially for young patients with relapsing remitting MS. But the treatment isn't widely available anywhere in the world. And although Nick's current neurologist supports his plans to seek treatment abroad, he says most are dismissive.
So I spoke to many of, I guess, my previous MS neurologists about HSCT. They were all against it. Some of the feedback I was getting was, no, it's not proven, it's still being tested, don't do it, it's going to kill you.
This is Tecfidera.
Nick was offered the standard first line of treatment for his MS, drugs.
It's a pill for relapsing MS.
Although they don't come with the upfront risk of a stem cell transplant, which has a mortality rate of about 0.5%, drugs only hold out the promise of slowing rather than halting the disease. They're often ineffective, and many come with significant health risks.
Tecfidera may cause serious side effects, such as allergic reactions, PML, which is a rare brain infection that usually leads to death or severe disability, and decreases in your
I jumped onto an MS drug called Aubagio. I was taking Aubagio tablets every single day for up to 12 months.
Since I've been on Aubagio, I haven't had any relapses, and my doctor hasn't seen any progression in disability.
But they obviously didn't work for me. Lesions continued.
In Australia, clinical trials for stem cell transplants only accept people who've failed to respond to multiple drug treatments. Nick's been told he doesn't qualify because he hasn't tried and failed at least one other drug.
Which just leaves us dumbfounded as to why on earth am I meant to be trying MS drugs? You want me to progress in the form of disability before you give me an opportunity to actually get my life back? Makes no sense whatsoever. I guess we're just frustrated that they've been doing a trial in Australia since 2012 and not allow MS patients to jump onto this and reap the benefits of it and force us to go abroad for treatment. Give people a real option. Give people an option to actually get their lives back. There is no cure yet, and I wish one day there will be for MS patients. But right now, the best course of treatment is HSCT. So Australia really needs to pull their finger out and give that option to Aussies. Don't force us abroad.